Good evening. This presentation is on Williams syndrome. Williams syndrome is a rare genetic disorder that was discovered by Dr. John Cyprian Phipps William in 1961. He had four patients that had similar facial features, a similar heart condition, and their disabilities were very similar. As he looked at all the information and gathered the data and did research on this, they decided to call it Williams syndrome. 3 years later, another doctor, a Dr. A.J. Buren, had three patients that had the same. He confirmed the findings of Dr. Williams. So they renamed the syndrome Williams-Buren syndrome. The diagnosis of Williams syndrome occurs in early infancy or early childhood. It's rarely picked up in pregnancy. It, it's kind of discovered afterwards. Um, and it can be detected through genetic testing. It's also detected due to the distinctive facial features. And these children also have elevated levels of calcium in their blood and a condition with their heart called a supravascular aorta stenosis, which is a congenital heart defect which causes the aorta to narrow. Um, Williams syndrome affects boys and girls equally. It occurs in 1 in 7,500 to 10,000 births worldwide. Williams Syndrome.org reports that an estimated 20,000 to 30,000 people are born with Williams syndrome in the United States. In the article Healthcare Supervision for Children with Williams Syndrome, they define Williams syndrome as a deletion of the genes 26 through 28, and it's a spontaneous deletion, just meaning it just happens. And these genes are found on chromosome 7. The deletion affects the structural proteins that are found around the connective tissue of many organs. This results in specific physical and internal characteristics that are found in children diagnosed with Williams syndrome. This could be the distinct facial features, which are the broad forehead, narrowest at the temple. There could be some swelling around the eye socket, a star-shaped or lacy iris pattern, wide full lips, a small underdeveloped jaw, and widely spaced teeth. Williams syndrome can be passed down to offspring through the maternal or paternal line if a person with Williams syndrome has children. The Williams syndrome website, however, notes that it's unlikely for other family members to have Williams syndrome due to the spontaneity of the deletion occurring in just 1 in 75,000. Some of the behavioral characteristics of Williams syndrome. Um, Children with Williams syndrome can struggle with significant issues, which include intellectual disability, learning disability, cardiovascular, and sensory issues. They also have a long list of health issues that can be concerning for parents when their children go off to school. Collaboration with healthcare, early intervention, and other related service providers is especially important in assisting with these developmental delays. Teachers, once they enter pre-K, can help parents by implementing an educational, individualized education program to assist with the functional, emotional, and educational needs of the students. Teachers also can build partnerships with parents and caregivers to gain insights into what the strengths and challenges that could come in, that could, oh my goodness, that could affect the developmental domains. Social emotional, children with Williams syndrome are described as being social, friendly, and daring. Sometimes they can be a little too social. Some children have difficulty with emotional regulation. Even with their social nature, it can be difficult for them to decode social cues, which can impact their ability to maintain friendships. In children that have language delays, there's many symptoms that have the crossover for autism and ADHD. Therefore, once they hit pre-K, it's really important for some additional assessments to be recommended. to the parents. As children shift into adulthood and exit high school, and they're no longer surrounded by a school community, the lack of socialization can negatively impact their mental health. So, also, even though we're pre K, as they're progressing through high school, having those conversations with parents on making plans for their future. Because Williams syndrome affects the connective tissues of the body, um, speech is often delayed. Speech therapy is recommended to improve their articulation. In an article by Morris et al., they report that cognitive, motor, and language delays are universal in children with Williams syndrome. And within that cohort, that 75% of children with Williams syndrome are diagnosed with an intellectual disability. Research on language development, however, is mixed. In a study by Martins et al., they found that vocabulary, morphology, and syntax were initially delayed, but as the child progressed through elementary school, trended towards normal progress. They also found that in toddlers, they may not use as many gesturing skills, hand movements, facial expressions, and other nonverbal skills, which could impact their language development. Some cognitive and academic challenges. In the majority of studies by Martin et al., they found that the cognitive ability assessed by the Wechsler Intelligence Scale, that they have a mean IQ that lies between 50 to 60 with a range of 40 to 100, which is kind of a large range. However, on the WISC, they found a discrepancy between IQ and verbal scores. The verbal scores were much higher. Children with Williams syndrome's verbal scores tend to exceed their performance skill. In an academic setting, they'll struggle with math and writing due to difficulties they have processing information, retaining that knowledge, and applying problem-solving strategies. They do have a good ability to become readers and the ability to develop a sizable vocabulary. They commonly have difficulty with visual spatial task demands, and this could include identifying a correct mathematical symbol or understanding written information. With physical and motor development, fine motor, visual motor, and spatial perception performance tasks may be difficult for children with Williams syndrome. They may have difficulty with jacket, tying shoelaces, or producing legible handwriting samples. When given the task of copying shapes or completing the puzzle, these fine motor activities, they may have some difficulty there. This could be due to the lack of communication between the hand and their ability to visually track across. So some educational strategies that teachers can use in the classroom. It's going to be important to establish structured routines with clear expectations. Structured routines in the classroom can help students with Williams syndrome overcome anxieties that may manifest in your students that have some of the markers of ADHD and autism. The routines also assist with the development of time and task management. Behavioral support such as social stories can help your students adapt to new routines in their daily schedule. Social stories can help them also understand what behaviors are acceptable in different social situations. You may want to do a social story on, hey, this is my personal bubble, or this is how we play games together. How do we show good sportsmanship or making friends? Another area where educational strategies is the multisensory play, and it's suggested that you create opportunities for your students to connect through cooperative play. Your students may benefit from having a peer buddy that can help model appropriate social behavior and demonstrate skills such as turn taking, sharing, and reciprocal conversations. Music is a huge strength for students with Williams syndrome, and it can help them in many ways. Putting music to nursery rhymes, adding gross and fine motor movements, and then also music can help with those pre-reading skills. Music can help students understand grammar patterns and develop communication skills. They can learn to sing and dance to letters, calendars, colors, and shapes. To help with the development of vocabulary, a word wall might be something that helps not only your children with Williams syndrome, but your entire classroom. The word wall provides opportunities for repetition and provides all students with an opportunity to see, explore, and explain what they've learned. So families that are making that transition from the home into the pre-K environment may have some pretty serious concerns. They may worry about how their student is going to thrive in a new setting, how their medical issues will affect their functioning away from home. So if we look at some of the issues that come with Williams syndrome, we're looking at they can have heart issues, develop hypertension at any age. They're prone to dehydration and constipation, which couples with having nutritional issues and feeding issues. So you've got a whole bunch in from dehydration to food to nutrition that can affect their functioning in the classroom. And then also urinary tract malfunction. Parents may also be concerned about their cognitive, so how they're going to assess academics, their sensory, and their behavioral needs. So prior to entering school, parents should be contacted by their early intervention team um, and develop a plan with their special education team on how to best address the medical, educational, and their behavioral needs. Some resources that are out there with parents that you may want to share with them. The Williams Syndromes Association goes over on their website, they talk about um, what is Williams syndrome, how is it detected, what are resources at home, what are resources at school. And it also has different stories and vignettes for parents to watch. There's in the state of Utah, there is also a local family support volunteer for Williams syndrome, and she is based out of West Valley and has a local Facebook group. There's also Williams syndrome, a parent's perspective, that talks more about what a parent can expect when they're raising a child with Williams syndrome. And these are my references. Thank you for listening.